Good morning. I am Dr. Kumaresh, Senior Consultant, Dr. Kumaresh ENT Clinic, and Visiting Consultant at Fortis and Manipal Hospitals. Today, I am going to discuss about nosebleeds. I'm sure you would have had it. Someone in your family might have had it. And when someone gets nosebleed or bleeding the nose, generally they get very panicky, think it's an emergency, rush to the ER, and then the panic itself will increase. So let's split it into part by part, and we'll discuss how to manage it. So you get up to go to the restroom, you find there's something dripping, or when you got up, you find your child's pillow is having blood. The first thing natural human response is you get panicky. Oh, what's happening? That is something which you have to avoid, because when you get panicky or when you see a child's the blood in the pillow, the first thing you do is try to wake him up. He gets extremely emotional and he gets very afraid. All these will increase the bleeding. So you are seeing bleeding coming from the nose. It can be drops or it can be a flow. Understand only one, 90% of the time it comes from the front part, and in 10% time can come from the back of the nose into the throat. Those are the ones which it's kind of worrisome, because it can be because of increased BP or tumors and anything. Majority of the front part or something not to be worried. So does that mean if you have a bleeding you should not meet a specialist? No, I'm just telling you, don't be panicky. That's what I meant by saying not to be worried. So you're seeing bleeding. What is the first thing you do? People immediately do like this. You should not. That is extremely harmful. So if you see there's a bleeding and you see that's coming by drop, it's not stopping, bend your head like this. See here, this is a hard part. Can you see? Just below that, it's a soft part. You can see the soft part here. Okay, pinch it, open your mouth like this, and keep it like that. So bend down, pinch your nose tightly, open your mouth, and just be like that. The bleeding will eventually stop within a few minutes. Let's say it's been more than 15 minutes, bleeding is not stopping, then you have to go to the ER. But majority of them it should stop. So it has stopped. So what should you do? If it's happened only once, also it's better to a specialist, or you say it's happened once, you can wait. But please do not self-treat yourself. Don't go to some medical shop and say, and they give something, and don't make it worse. So now what will be the causes? In children, generally it's because of nose picking. In adults, it's because of the dryness of the nose. If you have got severe allergy, there is some with what we call it as a terminal hypertrophy. There is going to be the bulging of the mucosa. There is going to be the mucus which is going to accumulate it. All that will be irritating. Sometimes it could be because of an infection. So all these are very common, treatable, not to be worried. In few cases, let's say in adults, if they are on blood thinners, or let's say the high blood pressure, those things can come from the back of the nose into the throat. That can be worrisome. If that is the case, yes, you can go. So if you're going to have torrential bleeding, you find that's getting into the back of the throat, and it's almost like a tap getting open, or an elderly patient where it's not coming in the front but going into the throat, then it can choke them. So then you have to, these are some of the conditions where you take them to the emergency room. So otherwise, so takeaway is, don't get panicked. Panic only worsens the problem. Bend down, pinch your nose, open your mouth. That should stop. If it stops, meet up with your specialist, and he will tell you the do's and don'ts. Just follow them, and that should help you. Hope this was useful. Thank you.